Allow me to take you back to a memorable moment when I found myself standing in a school hallway, waiting for my turn to receive the COVID-19 vaccine. It was a remarkably simple process for me: an email notification, a short walk to the school hall, and a quick, painless injection. I felt a sense of personal responsibility and pride in contributing to the health of our community, and the security it brings to the health of all. However, as I looked around the hallway that day, I couldn't help but notice the absence of some of my peers. It dawned on me that not everyone was as eager or willing to take the vaccine as I was, despite its accessibility. This juxtaposition, where some of us were taking the vaccine, while others remained hesitant, raised questions for me that have since driven my curiosity. I began to wonder how we can encourage those who are hesitant to see the importance of vaccinations, not just for themselves, but for the broader community. For me, this moment was the start of a journey of exploration into the intricate interplay between science, society, and religion that shapes contrasting views towards vaccines. To fully comprehend the arguments that can be posed in relation to vaccines, we first need to understand its importance and the effects it has on society. When we choose to vaccinate, we contribute to what's known as herd immunity, which is when a significant portion of the population becomes immune to a disease, with enough being resistant to its cause that the disease has nowhere to go. So, while not every individual may be immune, the group as a whole has protection, and it forms a protective shield around those who are most vulnerable, such as the elderly, the immunocompromised, and those unable to receive vaccines due to medical conditions. According to the World Health Organization, the WHO, for diseases like measles, mumps, rubella, and polio, it's estimated that 93 to 95% of the population needs to be vaccinated to achieve herd immunity. This high level of vaccine coverage significantly reduces the risk of outbreak. Also, herd immunity helps to reduce the burden on healthcare systems. For example, the Global Polio Eradication Initiative has prevented millions of cases of paralysis and death since its inception in 1988. Through this, it has been estimated to have saved $27 billion in healthcare costs by 2019. These numbers show us that by vaccinating and contributing to herd immunity, we not only save lives, but also minimize the social and economic disruptions that often accompany epidemics. So why is it from these benefits people still choose not to be vaccinated, knowing the risk to themselves and others? Let's look at Novak Djokovic as an example. He made the decision not to take the COVID-19 vaccine, a fact heavily covered in the media, as it prevented him from playing in the Australian Open and led to him being deported from the country in January 2022. The decision he made was rooted in principles of individual autonomy and personal freedom. In an exclusive interview with the BBC in February 2022, he said that he was prepared to forego the chance to be the greatest player that ever picked up a racket statistically and to miss Wimbledon and the French Open due to his opinion that the principles of decision-making on my body are more important than any title. So his choice reflects the discomfort some may feel about vaccines introducing unfamiliar substances into their bodies that they do not fully understand. It can be ruled out that Djokovic outright rejects vaccines, as he has received vaccinations as a child. So Djokovic is a high-profile example of the tensions between public health initiatives and personal autonomy. If Djokovic, a high-profile case, can be used to support reasons towards not taking the vaccines, can we use other high-status individuals to advocate the benefits of vaccines? Religious leaders have emerged as influential advocates in the global campaign to promote the COVID-19 vaccine, harnessing their moral authority to rally their followers. Pope Francis, in particular, has championed the vaccination within the Catholic community and beyond. In August 2021, in a video to his followers, he said that getting the vaccines authorized by the respective authorities is an act of love. He then further progressed on to saying that it shows love for oneself, love for our family and friends, and love for all people. This message reverberated throughout the Catholic world and beyond, resonating with other faiths as well. On many occasions, religious leaders have leveraged their influence to emphasize the moral and ethical implications for vaccinations, which has had a significant impact on its uptake. For instance, within the United States, a survey by the Public Religion Research Institute found that religious individuals who received clear encouragement from their leaders were far more likely to take the vaccines, as much as 86% more likely in some cases. In the United Kingdom, leaders from various faiths have similarly contributed to vaccine promotion. According to the National Health Service, the Joining the Dots initiative, which involved religious leaders in vaccine advocacy, resulted in a substantial increase in vaccine acceptance among their communities. In one of the participating areas, vaccine acceptance grew from 53% to 78% among Black, Asian, minority ethnic populations, underscoring the positive impacts of religious endorsements on vaccination rates. Turning away from the West, in Egypt, where approximately 90% of the population is Muslim, the Grand Imam of Al-Azhar, a highly respected and influential establishment in Sunni Islam, issued a fatwa. This fatwa was instrumental in promoting vaccine acceptance in Muslims in Egypt and beyond. In fact, as a result of these efforts, Egypt achieved significant progress in its vaccination campaign, with over 10 million vaccine doses administered. So religious leaders across different denominations have shown that they can increase vaccine acceptance by disseminating accurate information, address concerns, and dispel misinformation, thus aiding in the broader goal of achieving herd immunity. Culture also seems to influence vaccine acceptance. Different racial and ethnic groups have very different rates of vaccine uptake. According to a report by the UK government, vaccine hesitancy is highest in Black or Black British communities, with 72% stating they were unlikely or very unlikely to take the vaccines. In Pakistani or Bangladeshi communities, vaccine hesitancy is the second highest, with 42% stating they were unlikely or very unlikely to be vaccinated, while white British or Irish communities were the second least hesitant in the study, with only 16% stating they were unlikely or very unlikely to be vaccinated. So cultural beliefs about vaccines seem to vary across communities. Some cultures may have general mistrust towards Western medicines. For example, in 1996, Nigeria experienced one of the worst meningitis outbreaks in its history. The US pharmaceutical company, Pfizer, used the situation as an opportunity to test the efficacy of a new antibiotic called Trovin in the pediatric setting. They selected a sample of 200 children to partake in the trial, and a month later, 11 of the children were dead. On top of this, numerous parents of the children reported disabilities among their children, including paralysis and liver failure. It was later exposed that the trials were unethically conducted by not getting informed consent from their participants, as parents claimed that they were not informed of the experimental nature of the drug. So vaccine hesitancy seems to be highest within these communities. Also, followers of certain religious groups may be vaccine hesitant due to the ingredients the vaccine may be derived from. For example, in Jewish and Islamic communities, the consumption of pork is forbidden as it is considered impure, and the Islamic holy text, the Quran, forbids the consumption of pork. So this prohibition extends to vaccines containing pork, which leads to a significant hesitancy due to a conflict in values within these major religions. Also, in some conservative Christian denominations, the use of fetal cell lines causes hesitancy, as they believe in the sanctity of life from the Bible. So their moral dilemma results in this hesitancy by some in vaccines like the MMR vaccine, which is developed using fetal cell lines. Therefore, understanding these cultural factors plays a major role in helping these communities find solutions to this hesitancy. So, are great scientists really the answer to the success of vaccinations? While some may argue that they hold the exclusive key to spreading its message, the reality is that religious and cultural leaders, as well as influencers and celebrities, play pivotal roles in vaccinations, leaving lasting impacts on our society. Therefore, if we unite to dispel vaccine hesitancy, who knows whether this hesitancy may be a thing of the past. Thank you.